Hey everybody, welcome back. I'm your host, Susan Lindner of the Innovation Storytellers Show, where we don't just talk about the innovations, we talk about the stories that get big ideas to the finish line. And I can't think about bigger ideas in the world than those surrounding our health, global health. And if the pandemic has taught us anything, it's to stop and take a breath for a moment and see not just where we are in need, but also where innovation can help. And that's why I'm so excited to have Louise Agersnap on the line with me today. We are talking about all things healthcare at the WHO, this intersection of health and innovation and how we move the planet forward by using innovation principles to get there. So Louise is a change leader with extensive experience and knowledge of global health, development, and the innovation ecosystem acquired over 20 years at places like the UN, in the private sector and government, NGOs, and academia. Creativity and entrepreneurship are at the heart of everything she does, demonstrated by the track record of innovative initiatives throughout her career, leading innovation to promote sustainable development. Louise is currently the head of the Innovation Hub within the Department for Digital Health and Innovation at the World Health Organization. And there she leads the strategy and implementation of the WHO's innovation in health work. Throughout, she draws on her own social science academic training, her artistic background, and passion for positive transformation and impact. Louise, thank you so much for joining me today.
Thank you so much, Susan. I'm very happy to be here.
So this is going to be a great conversation. I have a brief history in public health. My last job before getting started in the world of innovation storytelling was as a field epidemiologist at the Centers for Disease Control, tracking all different variant and resistant strains of HIV coming into the United States. That feels like a million years ago now in the wake of COVID, when we were all so fixated, right, on all these different variants and different strains coming into our respective countries. And it's really the WHO who's been kind of the global overseer, I would say, or the global insight giver as to how we manage everything COVID from a global scale. But today we're talking about something that perhaps a lot of people don't see, which is that the WHO is also at the forefront of innovation and really looking at how we approach public health in new and exciting ways. It's one of the reasons why I'm so excited to have you on today. Tell us a little bit about these kind of epidemiological shifts that we're seeing in the world. I think for a lot of my audience working in so many different industries, we don't stop for a moment and think about how global health is impacting us on a day-to-day basis, impacting our industries. But every day, the world of health is impacting how we work and how we innovate. Tell us a little bit about the epidemiological shifts you're seeing.
Sure. So WHO works on innovation in many different areas. I'm speaking about what we do in the WHO Innovation Hub, where we focus on two things: the culture of innovation, as well as the support to scaling innovation in countries. And we're working closely with our colleagues in the regional offices and countries, as well as the technical departments in the respective health areas. But global health is under tremendous pressure at the moment, more than ever before. Not only did we go through a pandemic, which I think has marked all of us, but there are also big epidemiological shifts happening where the so-called non-communicable diseases, which are chronic diseases such as cancer, cardiovascular disease, lung disease, asthma, diabetes, mental health illnesses, etc., are growing and are now also becoming a major concern in countries where previously it was more infectious and communicable diseases that were of concern. So NCDs, as we call them, the chronic diseases, are on the rise and also putting incredible strain on health systems all over the world. And at the same time, we have climate change and demographic shifts. And we just, in terms of sheer numbers that I think tell us about the challenge we're facing, there's 1.6 billion people globally who are without access to healthcare in situations of crisis. We have 41 million people who are dying from these non-communicable diseases and 2.5 million babies who die, or newborn babies who die each year from preventable causes. So we have a lot to do. And a lot of this is not just happening in the health sector. These are challenges that require collaboration across different sectors. So it's health and development that we need to look at writ large, how we design our infrastructure, the urban infrastructures, how we produce food, how we design our organizations, etc. So this calls for collaboration, it calls for innovation.
Yeah. And so tell us a little bit about the WHO Innovation Hub. How is it structured and how are you seeking to meet these demands right now?
So in the Innovation Hub, we are working in three major areas. The first one is to act as a broker and a scaling partner with our 194 member states. So this is about being demand driven, and this is a shift compared to previous times where I think there's been an exaggerated focus on the supply of innovation, and a lot of innovation hasn't really met the needs of countries. So we're trying to address that, and we're trying to also work with countries to raise awareness about the public sector's opportunity to adopt innovation at the core of its mission. The second role we are playing is to be a catalyst for learning. You could also call it capacity building, but we really think that this is a joint exercise because all participants in this multi-stakeholder endeavor have something to learn and to share. So we can be a convener and a powerful convener in that space, bringing together different stakeholders and actors and sectors for joint learning about how we're going to do this and what's the culture of innovation that we need to nurture in that regard. And we have different platforms for doing that. And lastly, we are a standard setter in the innovation scaling space. And that's, again, something that speaks very much to WHO's traditional role of being the leading international coordinator and technical agency for global health, public health. So we help harmonize the language and the standards and the understanding of what innovation is and how do we go about scaling innovation in countries. And there are plenty of guidance around that already, but still some missing. So we use something called WHO ExpandNet guidance, different guidance on how to scale innovation. And we're also developing our own types of technical products, such as what we call blueprints for innovation, that governments can use as sort of templates for engaging on innovation, running tenders on innovation, etc.
So can you give us some of examples? I mean, all of us and all of my listeners, we're involved in this kind of finding brokers, finding connectors, finding those who will help us scale our big ideas to new levels. Can you give us some examples of how you're doing it and maybe take us there to a place like Somalia? Like, how do you wind up putting forward these innovation projects in places that are really challenged?
So yeah, Somalia was, I think, the first place that we tested this new approach that we call matchmaking. So matching the demand from countries and their priorities in public health with sustainable, scalable solutions. And the third sort of leg of that is assessment of innovation. So using the technical expertise of our own technical departments in that regard. So this demand supply assessment triangle, which we also call the WHO scaling framework. And what we did with that concept was at the beginning of the pandemic to reach out to our regional innovation leads and asking them, what are the demands that you are receiving right now from our member states? And one of the things that really came out strongly was the need for innovation in oxygen delivery. So we went to our established partnerships with innovation funders and aggregators, in this case, the International Development Innovation Alliance, IDIA, and their platform called the Million Lives Collective, and we asked them what they had in their supply pipeline. A lot of this is, by the way, sourced from all over the world, and a lot of it is already implemented in places like Somalia. They came back to us with 6 oxygen innovations of different nature, and we ran that through our technical department for emergencies and innovative technologies, and they had their experts assess it and came back with 5 of these, saying these are acceptable. We took it back to countries, and long story short, Somalia's Minister of Health and WHO's country office selected 2 of these. And one of these is a solar-powered oxygen concentrator, which we installed in 3 different sites in Somalia, very remote primary healthcare clinics, where the solar panels that were installed there were actually big enough to also give solar power to the rest of most of the clinic, so that they also had light for during surgery at night and for other life-saving technologies. And I went there myself about 18 months ago, and it was really a transformative experience to see how such a simple solution can save lives. And interestingly, it's actually saving lives primarily of newborns with pneumonia who would otherwise die. But by having access to reliable oxygen for a certain amount of days, their lives are saved. And I should say it's interesting also that we are in the health, public health sector, but what we're solving here is actually an electricity and a power problem. So the problem here is that Somalia doesn't have a national electricity grid that is reliable. And so hospitals or little clinics are running on diesel generators, which are very polluting and are also not reliable at all. So an oxygen concentrator would immediately have, there would be power cuts throughout the day. And of course, you will lose lives in that situation. So this has been a big game changer and lifesaver in Somalia. And they are now in collaboration with us and the technical departments and in service of the government, scaling this to 75 different clinics and solar powering entire clinics, which is amazing.
This kind of thinking, right, about how we, number one, do a really good needs assessment, right, and allow our partners to choose. We don't impose the innovation on someone, but rather we work together to figure out what's most critical, looking at impact, not just looking at innovation for innovation's sake, right? This would be the coolest thing to deploy, but rather what's actually going to have cascading benefits beyond the immediate impact, right? It's so fascinating. And ones that perhaps, as we're thinking about scaling an innovation project, is not just what's here in the day that we're addressing, but what are the potential follow-on benefits that will allow a project to scale and grow and continue and really revive a lot of learning to apply to the next project. I think sometimes we get so fixated on the thing that we're implementing, we forget about the ripple effects from that one project. It's phenomenal. And that, I guess, feeds into the second half, right? Which is really being a catalyst for learning. It comes from the projects themselves, but it comes in lots of different ways too, right? As really being an exemplar to lots of other regions and nations that can borrow from these ideas.
Absolutely. So right now, just to delve a bit more on this country demand and how we can help channel that and link it to and match it with sustainable innovation. What we did in Somalia got support from partners, in particular Grand Challenges Canada, who's now supporting us in taking this forward and demonstrating and testing this role of being what we call an ecosystem catalyst for country demand for innovation. So that ecosystem catalyst for demand is really about using WHO's presence in 194 countries. We have 150 plus country offices, and through them and our member states, we have a very good sense on the ground through our leadership on the ground of what is it that countries prioritize and where are the big pain points. And then we can, from a global hub, help link with powerful partnerships with the innovation pipelines that are not driven by profit, but really by looking at what is it that saves lives, improves lives, and is assessed to have that kind of impact, and then link that up. And of course, I think it's critical here that we're being led 100% by the demand side. This is about what governments need and what their people need. It's not about what the supply chain wants to push out. So we listen to the demand, and then we also approach this from a systems perspective, because it's not about the thing, as you said. It's not about, even if a government demands a certain solution, our approach and the guidance that we use is really a systems approach, where you look at how this is embedded in a primary healthcare setting, assessing what is the capacity needed, the finance, the policies, the culture. It's all that messiness around an innovation that will eventually determine whether it scales in a sustainable fashion.
Yeah, for sure, right? And it's a fixation, and we always talk about falling in love with the problem, not the solution in innovation, right? If we can stay focused on the problems that we're solving, then we have an opportunity to really do great things.
Exactly.
Yeah.
And so what we're going to do next is actually to try to replicate that approach of being demand-led and engaging with our countries and regions with this support. So we will be looking to do 6 projects across sub-Saharan Africa over the next year that will scale. We're looking at mental health, social innovations in different countries. We're also looking at something called kangaroo mother care, which is a fantastic approach. And kangaroo mother care is actually not an innovation as such. It's what we call an evidence-based intervention in WHO and medical language. It's really about skin-to-skin care for up to 20 hours for newborns and their mothers, or newborn and a surrogate. And this is for newborns that are low birth weight or premature. And it saves significant amounts of lives by just that very simple method, combined with breast milk feeding and a couple of other features. But it's very simple, and it makes a big difference in places like Somalia, where 80% of babies are born outside health facilities. So in terms of that systems approach, that's where innovation comes into the picture. So this particular approach has actually been requested in Somalia as something that they'd like to take to scale. And we will be involved in terms of looking at how to scale this sustainably. And what does that mean in this context, where it's actually not about what happens in the hospital, it's about what happens out in the communities, and sometimes in nomadic communities. How do you make that a lasting approach to saving newborns? It's a fascinating project, and I look forward to it, and as well as the other projects across sub-Saharan Africa.
Yeah, well, you'll have to come back and tell us about it. So I
Happy
want to
to.
dive into this idea a little bit more about culture, because it's something we talk about a lot on this show, of innovation culture. You're in a very particular kind of opportunity to create innovation cultures, both at the health delivery level, but also in conceptualizing it for your member countries, and then also on the ground, right? That we empower practitioners to think about empowering them, and also getting feedback from them to create an innovation culture, so that it becomes part and parcel of how we work and how we think, creating new mindsets around that. I know you and I were introduced by Kev De Silva over at Ideateplus, a fantastic European-based innovation consultancy, and I love working with. Tell us a little bit about how we imbue innovation in the form of a challenge, or in the form of different ways that you're kind of fleshing out this innovation culture for your stakeholders.
Sure. We're running a program, and this is where Kev De Silva and his team are delivering coaching services to our staff and doing a really great job at that. We have a program called LEAD. It stands for Leap, Engage, Accelerate, Disrupt. And it's a WHO Innovation Challenge that we run globally. It's normally run on a 12 to 18-month cycle. And it's running as an innovation challenge that most people know. There's a phase for ideation, validation, experimentation. And in the course of that, you get mentoring, you prototype. And we also have seed funding for those that are making it through different stages of review by an independent panel. So that's really exciting, because it's about creating a space and a platform that has resources and space for doing this work to staff globally. And we've had, I think, about 250 ideas that have been generated through this program. About 40 plus of these are getting mainstreamed, or on the course to becoming mainstreamed in the way that we work, either in our business operations or in our technical health programs. So that's very exciting. And we're also putting more and more emphasis and investing our approach in securing more and more engagement from our regional and country level colleagues, because in the end, everything we do is about country impact. So the more that we can drive the emphasis out to countries, the better. And it's been amazing to see how that's actually been successful, and we have managed to increase the numbers and have more and more innovations that are being used by the Ministry of Health, being rolled out to 1 million health workers in India or other places. That kind of impact is what we're beginning to see. Because it's not easy to, with a 12 to 18 months project, you don't want to see projects then be dropped as soon as you're done with the program. So we're also building in more scalability and sustainability of the ideas that come through from our own staff. And to see that creativity and really an innovation culture that is built in terms of capacities for understanding problems, doing problem solving, ideation, developing ideas, prototyping, and also working across different departments and being more diverse in our approaches is really amazing to see.
Yeah. So this is the Innovation Storyteller Show, right? How do we think about the communication? It's astounding. I mean, I'm thinking about some of my listeners who are like, God, I'm just trying to get the engineering team on board with this big idea for a prototype. I can't imagine trying to do that across 160, 190 plus countries, right? When we're thinking about scaling. I mean, your task is really Herculean. Tell us a little bit about the conversation. What are the stories that we tell to get other people on board with these ideas? Because we don't want it to feel like in olden days, this kind of command and control structure, right? Where we're just like, here we are with our cool new innovation. We'd like to hand it to you and you better use it, right? There's like this kind of, I don't know, I want to say like veiled pressure to make sure it gets done. What's the conversation like that gets people on board?
What I find to work really effectively is to connect with people's sense of purpose and sometimes also the frustrations that they feel in their daily work. We all have stubborn problems that we're trying to solve, and you don't have that space or pause to reflect or even reflect with others about what to do about it. So that's what this LEAD program creates. And we do the same, by the way, in a physical innovation lab that we have built at our headquarters called Eureka, which we're seeking to replicate in other locations over time. That's really the vision, for this to be a local space for that, connecting with the problems that we are so passionate about solving. Because I believe people, we all have that sense of purpose somewhere. Maybe it's not connected directly in our work, but I think in places like WHO, that's the privilege, I would say, that we have, that we are so close to big problems of the world that we are in a position to affect.
Yeah.
And then, of course, you can be frustrated because you don't feel that you're doing enough, or there's a problem or a technical program that's not having the reach that it needs to have. And that's when you can, if you create the spaces for reflecting and asking the questions and working with others, you start understanding that there may be a solution, but it's not something you can do alone. And you may need to work with a couple of other departments, the regional office, the country office, the Ministry of Health, maybe another ministry, and just getting that multi-stakeholder, multi-sectoral engagement into the mix is really stimulating for most people.
Yeah.
So starting with that purpose, I think, is key. But otherwise, storytelling is critical, and it's about igniting striking the emotions of people, but doing it with the real stories of what it is, the problems we're facing, and what are the solutions that we actually have at our fingertips.
Yeah. It's so funny because you're taking me right back to my public health days and trying to stem the flow of HIV back in 1995, right? Where I lived, 1 in 6 sexually active people was HIV positive. There were probably 3 AIDS funerals a day where I lived. It was very present. The need was dire and urgent, and we didn't have any great breakthrough innovations to help us. All we had was the condom and abstinence, right? That was pretty much all we had in a place where prostitution was part of weekly life, let's say, for most of the men where I lived. So it's fascinating when you look at the enormity of the problem, the urgency of the problem, One of the things that we used that was helpful, we didn't necessarily know it at the time, but in design thinking, we now have these tools, something like an empathy map, where we ask people, okay, what is my population really getting influenced by? And for all of us influencers, innovators rather, thinking about who is influencing my target market, right? Who is really, what are they listening to? What are they seeing and hearing? And how are they behaving in day-to-day life that I can understand what matters most to them? And then the two big questions as part of this empathy mapping process is, what is the pain that my target market will have to endure if they say yes to the help I'm offering? Because any kind of change from doing things in the status quo versus going into something new requires pain. I'm giving, even if I'm just giving up something, because at least I knew it. Now I'm trying something new and I don't know if it will work. But I have to shift my way of thinking, my way of relating, my way of doing, my way of explaining it. And then the other is, what does my listener gain? Not what I want them to gain, but what do they want to gain from indulging in this new innovation? What do they hope for? Rather than what my boss above me or what we hope to see as public health practitioners, what do my folks care about in the field? And I always concluded things asking this question: how can I make my recipient of this innovation become a hero in their own life, a hero on their terms? If I begin to ask those questions and I really begin to put a patient-centric or an innovation recipient, let's say for my commercial friends, those working in the private sector, how do I make them the hero? How will they feel, to your point, incorporating emotion into the storytelling? How will they feel like a hero if they say yes on their terms? And I feel like incorporating some of this design thinking approaches to how we do innovation in the field is so important. So often we're so excited with the thing that we've built that we didn't bother asking, why is this going to be hard for you to say yes to? And what do you hope to get out of it? Not what I hope to get out of it. I mean, I've had some researchers tell me, well, I'm hoping a Nobel Prize is in the future. I'm like, well, that's super. But have you thought really about the person who's using it? So before we hit record, we were also talking about creativity. And I think this is the place where things really open up. And Louise, you have an artistic background too, which we haven't really talked about, but tell us a little bit how creativity can play a bigger role in innovation. How should we think about it differently?
Creativity is the power or the fuel that we need to run on. And I think there's creativity both in the artistic practice, but also in science. There are some commonalities there that I'm quite fascinated with. We're trying to embed creativity as part of the innovation culture that we're building, both through that LEAD program, but also in Eureka. And we're using different techniques to do that. So you mentioned human-centric design and the importance of empathy, ownership of the ones that are actually going to use that innovation. So really engaging people and doing innovation scaling, not for people, but with people is critical, avoiding to do harm, unintended harm, etc. And what we do in Eureka, for instance, but also practices that are embedded within the LEAD program are human-centric design and what we call liberating structures. And these are different techniques that are really about creativity, diversity, collaboration, and really maximizing that. And what I do, recently we had these innovation Eureka days where we engaged our colleagues and partners about Eureka and showcasing what is the space, how are you going to use it? So we gave some trial runs of what do we mean by liberating structures, etc. And I asked people, have you recently been in meetings where you, during the meeting and afterwards, felt, well, only 25% of the ideas in the participant came out? And most people will recognize that as almost like business as usual. That's just the habits of meetings these days, that certain individuals will speak, the usual suspects will speak. It's often influenced by the hierarchies and the power structures, people's background, their seniority in the organization, etc. And that's not always that helpful for the solutions that we need to find, whether it's developing our next strategy or discussing a certain technical health program, etc. So with these liberating structures and human-centric design, you can get not 25%, but 100% of the creativity in the room, because there are techniques for making sure that everyone is actually jotting down their ideas and post-it notes. Afterwards, you will be asked to share them with the group, and there are methods of making it more effectively where you group the ideas on different themes, etc. And once you've written down your ideas, you're less likely to scratch that idea once the flow opens, as opposed to normal meetings where there's a chair that speaks, and a lot of people are naturally dropping the idea they had in their head. They will say, oh, maybe it's not so relevant or important what I have to say. And that's a shame. So we're trying to just get beyond that and say, how can we disrupt the ineffective way that we are meeting with each other?
Yeah. And it's
I
such a
see
good
the transformation in people. Once they've been through it, they may have been a little skeptical in the beginning, but after it, they normally come over and say, hey, this was really good. Can we do more of this? Can I bring my leadership team?
Yeah. And we know that's true, right? I mean, if you just think back to the last meeting you were sitting in, right? Who was doing all the talking? Who was quietly taking notes? Who was waiting till the last 5 minutes to share their mic drop moment, right? And suddenly you're like, oh, why didn't we hear that at the beginning of the meeting? We could have really used that way of thinking. But
Exactly.
yeah, and it's a good reminder to all of us as we think about running innovation sprints or agile stand-ups. Are we really getting the most participation from folks? And if not, why not? Why don't people feel compelled to contribute in a way that really helps move things forward and gets other voices heard? Too often we just respond to the loudest voice in the room, and we could be missing some of those real hidden gems there.
Exactly.
Yeah.
And often you want to hear from everyone, because if you are doing a joint project, to have someone sit in the group and not really be contributing or sharing if he or she disagrees with what's being proposed, etc., you'll have a problem later. So you better find a way to get it out constructively.
That's a really good point, right? We've all been in that place. Why didn't I hear that 6 weeks ago?
Yeah, exactly.
And those are some of the innovation missteps, right? Where people feel, ask yourself, leaders, are you creating an environment where everyone feels comfortable to speak, right? And share. And this is so important, especially for the work of the WHO, right? I mean, you're working across so many cultures, right? Even just understanding what does a typical meeting look like in Zimbabwe versus Somalia versus Chile versus Bangkok, right? These are very different ways that people tell stories, feel seniority, feel the opportunity to speak is theirs.
Exactly.
Wow. Yeah. Louise, you do not have an easy task, but it sounds like it's one of the most challenging and exhilarating ones. Is there anything else we should know? Like, what's coming next that we should keep our eyes on? You were talking about the Canadian challenge. I think I might be getting that wording wrong, but what else can we should be excited about that you're working on?
There's, yes, the ecosystem catalyst for demand grant that we are implementing now across several countries and helping to develop scaling plans for innovations in countries. So that's really getting our hands dirty and being part of that, I find very exciting. And it's also beyond the concrete projects. We are also sort of building a new model. It's a new approach to matchmaking and using matchmaking, as we call it, between the country demands and the mature scalable solutions. So it's both building a model and also doing something concrete. We will continue to develop the Eureka innovation space as a prototype that we are keen to replicate anywhere in the world where there's a need for this kind of collaborative, creative problem-solving space. And the LEAD program is also evolving and becoming more and more country impact focused, and with more and more concrete results where this is actually being used by our member states and in a collaboration with WHO. So that's very exciting.
Yeah, wonderful. Well, it's time now that I take you to our hot seat questions, where I ask all of my guests who are on the show some pointed questions about what's next. So tell us, if you had the chance to join any innovation let me beg this up. What do you think is the greatest innovation of all time?
Wow. There could be a lot mentioned there, but I think I would have to say, it may sound boring, but the mobile phone. I think we're so used to it now, having it as the omnipresent thing in our hand, always glued to our hand, almost the smartphone. But it has turned our lives upside down. It's been a useful tool for so many things. I'm not blind to all the downsides of screen time, etc. But there are so many useful purposes of the mobile phone, not least in telemedicine and digital solutions in innovation that can be embedded within that tool. So I would have to say the mobile phone. And maybe secondly, if I can sneak in one more, I would say the vaccines.
Sure.
And I know vaccines are not getting it's a very debated topic, but it's not getting the credit it deserves as a life-saving innovation. So I would mention the two.
Yeah, I couldn't agree with you more. And it's funny, I think phone calls are probably the least used element of the mobile phone these days. I know, like, I think I'm calling my mom, like, but for the most part, we're in such a texting universe these days. Spending time on the phone is, I think, the least used app on at least the younger generation's phone these days, for sure. So take us next. What if you had a chance to join an innovation team in history, which one would you have joined?
Well, so maybe I would say the brothers Wright as they developed the airplane, and just that whole discovery of how to defy gravity and fly. I think that must have been amazing. And I think they would also need a woman on the team, perhaps.
Amen. Absolutely. Because as people here like to say, they were the brothers wrong for a long time until they actually got that thing to fly. And then they truly became the right brothers when it got off the ground.
Most innovators are wrong for a long time until they're wrong.
This is how it works, right? You have to fail a million times typically. Okay. And then the next thing I typically ask folks is, tell us about an innovation you would love to see in the world, or something that just annoys the heck out of you that you wish somebody would figure out.
I think what really bothers me is plastic pollution, not just the physical plastic bottles everywhere, but also the microplastics in our environment, which we don't even think about in our daily lives. And I'm aware there are lots of new material innovations that are really fascinating and are beginning to get it right. We just haven't seen any of them yet be that silver bullet that just disrupts that whole plastic pollution problem. But I would really love to see a solution to that and see. Still, plastic is an amazing innovation. We're using it so much, not least in hospitals and healthcare. It's a lifesaver, but it also has a huge pollution downside that needs to be solved. So if we could have a plastic alternative that's environmentally friendly and sustainable, that would be amazing and really implemented at scale.
Yes. Okay. Calling all innovators who are working on plastic replacements. We are here for it. We are ready for it, and we want it now. Louise, thank you so much for joining me on the show today. Where can people get in touch with you if they want to learn more about all the amazing innovation projects that you're working on and the Digital Innovation Hub?
On LinkedIn would probably be the easiest. And thank you, Susan. It's been great. Love your show.
Thank you so much.